The inflation, the price of gas, beans. The reason the beans went up, Joe Biden's fault. It's all Joe Biden. Now, the weird thing is you don't hear anyone, really out there, except me, saying that, hey, we're reshoring manufacturing, investing in future technologies like the CHIPS bill, doing something on climate change. Yeah, Joe Biden's fault. Where's the giant statue? Where are the big cardboard cutouts with the finger and the where's that at? We had a bunch of idiots running around slapping Joe Biden did this all over things. How about let's talk about the things that he really did? And on the prescription drug front, yeah, did something that they have not been able to do since George Bush boogered it up back in the early 2000s. But here to talk about, well, just how this is going to work, how it's going to help folks, and maybe reduce inflation a little bit. I've asked our good friend Laura Packard to come talk with us. She's the executive director of Healthcare Voter. You can check out their website. I think it's healthcarevoter.org. We'll get links out on social media to make sure you can check that out. But Laura, thanks for taking time for us.
Thanks for having me.
So everything's Joe Biden's fault except for the good things that happen, like, reshoring manufacturing and bringing down prescription drug prices and all. Everything else is Joe Biden's fault except for this.
Well, there was just a big celebration at the White House this week to celebrate the Inflation Reduction Act. So Joe Biden, Dark Brandon Joe Biden, has actually got some great accomplishments to talk about.
So this is like Dark Brandon, or because I still love I'm still trying to figure out how to use the "Let's Go Brandon" frame in a way that say, yeah, he did. He went and he's made things better.
Absolutely. And so some of the pieces in the Inflation Reduction Act, first of all, it's keeping your health insurance premiums low for the next 3 years if you have insurance through the Affordable Care Act. That was going to expire at the end of this year, and I talked about it a few times on your show. Well, that's fixed, at least for 3 years. And as you mentioned, now Medicare is going to be able to negotiate lower drug prices for people on Medicare. That's going to take a couple years to kick in, but sooner than that is a $2,000 out-of-pocket max for people on Part D prescription drugs. So that is going to be really big for so many people that have expensive medications.
No, it's huge. But, you said 3 years that the ACA fix is going to be in place. I say we're at a crossroads moment because, that 3 years, in 3 years, the Republicans, if they take power in the House and the Senate and possibly the White House in 24, all that gets undone. And then we go back to the enormous number of wasted votes on repeal and then no replacement, because we learned during the Trump years that they don't really have a replacement. They have no plan, no idea, no direction, other than they know they don't like that Obama thing.
Exactly. That there's still no Republican health care plan. And yes, if they regain power, we would see in 3 years it would expire. However, we have this election coming up, and so we can do something about it because we don't have to let them take power. We can make it so that we have 50 Democratic senators in the U.S. Senate that are willing to vote for change. We're a couple votes shy of breaking the filibuster this last time, which is why they weren't able to fix to guarantee our right to an abortion, and they weren't able to make these healthcare changes permanent. But if we get a couple more votes, including in places like Pennsylvania, I think we can get there.
No, it's something I'm hoping the working class of this country is waking up to. But I'm going to push back on your thought, because I kind of said it too, that the Republicans don't have a plan. They actually do have a health care plan. It's on. You can actually put it on a bumper sticker, since they're really good at bumper sticker sloganeering. It's simply pay or die. That's their healthcare plan. If you have the wealth and you have the ability to pay, you're going to get the best treatment in the world. If you're like the rest of us who, don't, decrease the surplus population.
And part of their attacks on our healthcare, we saw a ruling just a few days ago from the same Texas judge that ruled the Affordable Care Act was unconstitutional. He's at it again, and he ruled that the preventative services piece of the Affordable Care Act is unconstitutional. So things that we take for granted now that we get for free with, free vaccines and so on, that is under threat. Now, this is just a circuit court ruling. It's going to go to appeals, and this is by no means done.
Right.
But this just shows that these conservatives are not done attacking our healthcare.
No, and it shows that, again, I keep coming back to this frame: elections matter. If we make the wrong choice again, and you end up with a Trump or a Trumpite in the White House, or in a J.D. Vance or a Dr. Oz. Oh, geez. Dr. Oz and his, hey, we should have healthcare festivals for people who don't have insurance. You can go to the field and have someone look at you for 13 seconds. That's healthcare in their world. But, if we make the wrong choice this November and in 2024, maybe healthcare festivals are the best we're going to get.
I remember before the Affordable Care Act, I remember, and I believe even still today, there are charity agencies that offer healthcare around the world, and they do days of healthcare here in the U.S. that thousands of people would show up to be able to see a doctor because they couldn't afford anything else.
Have you seen the photographs from Appalachia? You go down into parts of Virginia, parts of West Virginia, where they would do this. It looks like a third world country where they come and they put up tents, and you go, this is the healthcare system that this is what we do to poor people. This could never happen in rich, affluent areas, where DeSantis and Abbott and those folks who keep trying to shove this stuff down our throats. You won't find this near the Golden Palace at Mar-a-Lago. But in places where working people live, this is what we get.
And you can see right now with the numbers that just came out on the number of uninsured, I think it was the best was Massachusetts with 2%. And then you see Texas with, I think it was more like 15% or more of their folks are uninsured. And that's when you have situations where people can't get health care. And in Texas in particular, it goes right back to Governor Abbott and the Texas Republican legislature that refuses to expand Medicaid for low-income working people. That people who make too much money to get the Affordable Care Act, too little money to get Medicaid, they can't get help. And that is the responsibility of the Texas legislature and governor.
You listen to the Rick Smith Show. We're here with Laura Packard, Executive Director of Healthcare Voter. Their website, healthcarevoter.org. You can also see Laura on her weekly ACT TV program, Care Talk. We'll get links out on how you can take a look at that as well. Now, here's the weird thing. You said, they're 15% in Texas, 2% only in Massachusetts. The frame that I keep hearing from people, especially conservatives, is all those uninsured people, that's their choice. They don't want to be insured, because if they wanted to be insured, they would get jobs that had health insurance. It sounds ludicrous, but I get that from conservatives all the time. And the frame being, I did it, they should do it too. So I'm kind of curious your response to that.
Well, first of all, if you're sick, it is extremely hard to hold down a 40-hour-a-week job that provides insurance. And second, so many of the people that we used to call essential workers don't even have health care. The people that, provide you your food, take care of your kids, hard-working Americans don't have health care in their low-paying jobs. And so are they really essential? Are we treating them like essential workers? No, we are not.
Now we give them a nice little title pat on the back, but no raise, no health insurance, no security, none of that. Hey, it's the new American way. We're going back to the old days. It's the old new American way, where a company, an industry like the rail industry, who makes hundreds of millions of dollars in profits, coming out and saying, labor didn't do any of this. Labor didn't do anything to help us make skyrocketing profits, Laura.
Well, I'm hoping that the workers, the rail workers, finally get a day off. I think it's unconscionable that they're basically on call forever. This wasn't just about money; it was about paid time off. And we still haven't fixed paid family and medical leave in this country, but it just goes to show you can be a hardworking American with a good job and still not get good benefits.
No, I look at someone like you, a stage 4 cancer survivor. Nobody plans, nobody puts in their plan, I'm going to get stage 4 cancer. Nobody puts in their plan the health things that come and the fights that you're going to end up with. And, your story is one of the, I've heard sadly replicated, hundreds of times from people who said, look, I had the American dream. We lived in a little picket house fence. We were making good money. We were taking vacations, planning for college. We were doing all the things we were told we were supposed to. Somebody got sick. Bang, we're bankrupt.
Exactly. We live in a country, in one of the only industrialized countries, where healthcare is not guaranteed to us. And if you are too sick to work, you also probably lose your health insurance.
Now, I think back to a guy when we used to do these hungry and homeless for the holiday food events, where we would sleep out in the grocery store parking lot for a week. And I remember a guy we met, that's what was his life. In fact, he was a conservative his entire life. He had a heart attack, had some complications, ended up losing his job a couple months later, ended up losing his health care, didn't have any money, couldn't get Social Security disability, ended up homeless. Now, because of Medicaid, we spent hundreds of thousands of dollars to keep him alive, only to send him back to the street. And you go, there's something wrong with this system. And it's so badly broken that I think the average American goes, what can we do? So the question then, what can we do? Is this high on the priorities in this election cycle, or is it something else?
Well, I think that healthcare is on everybody's minds. I mean, we're coming out of a pandemic that killed so many of our friends and neighbors and family members, and we are making drugs more affordable. But this bill helps people on Medicare. It doesn't help people that aren't on Medicare with prescription drugs. And that's something, there's a $35 copay on insulin for people on Medicare,
Yeah.
but Republicans chose to strip it out for everybody else.
Yeah, how do you do that? How do you go, sorry, you're going to pay hundreds of dollars a month? And I think the governor of California is doing the right thing. The idea that the state of California is going to start making insulin and selling it at cost. If the private sector isn't going to be helpful, the public sector has to step in and do what we the people need. That's always been my mantra.
Mm-hmm. And there is talk that there may be a vote in Congress on a standalone bill to do something about insulin, and that's great. But it's so important that you vote for senators that'll vote for that. But also, we can't be just piecemeal fixing one drug at a time. We need comprehensive reform for all the pieces of our healthcare system.
What good is cheaper insulin if you can't get to the doctor to get it and get the follow-up care that you need to make sure that, my wife was just telling me about a friend who, just going through life, taking care of others, doing other stuff, finds out she's got diabetes, ends up losing a toe. And you go, that's not good. How'd that happen? Well, 8 months to get a doctor appointment, which is insane. Now, again, my conservative friends tell me, and I'm sure you've heard this, if we go to that hippie liberal social media that you want, or social medicine you want, we'll never get a doctor appointment. I go, have you tried getting a doctor appointment on short term in this day and age? It ain't easy.
And also, for some reason, people in Canada and the UK and any other country doesn't seem to want to give up their healthcare system for ours. But I think that we need to properly fund and make it healthcare available for everybody. And we also need to have more doctors, more medical personnel, because as baby boomers retire, there are increasing shortages of doctors and nurses and all kinds of medical professionals.
So last question I've got for you, because elections coming up, and I have people, especially my women friends. The women folk are looking at the November election or the Rovember election cycle as all about choice and reproductive rights and all of that. How big do you expect this to be? I mean, there's states like here in my state of Pennsylvania where they're going, that could be the issue that swings this entire election. Same thing with Ohio. Curious your thoughts.
Well, I think abortion affects everybody. And it isn't always something that you necessarily plan for, just like I wasn't expecting to get cancer. There's stories coming out, actually. I think there was a cancer patient in Ohio that couldn't get chemotherapy because it could possibly harm a fetus. So this person has just been diagnosed with cancer, needs chemotherapy, and then has to figure out how to get to another state to get an abortion so they can get the medicine they need. And there are so many stories like these. Women with ectopic pregnancies that it will kill them if they don't get an abortion, and they still can't get care. So it goes on and on.
It's God's will, Laura. God's will. It's God's will. Isn't that what they tell us? I mean, if you listen to the extremists, like, the guy who's running for governor in Pennsylvania here, this Doug Mastriano, under no circumstances can we allow to have any of that happening.
Well, I think if you believe that, didn't God give us a brain and help us develop medicine for a reason?
Well, not women. We don't want you women folk thinking, because if you listen to that video that I played yesterday on the program that Mastriano tweeted out, that the feminists, they want women back, they want women to be equal and get jobs and pay taxes, whereas your natural nurturing instinct should be home in the kitchen making your man pie.
Well, one of the issues with that is there was a woman in Texas that had an ectopic pregnancy and couldn't get care, and I believe ended up having a hysterectomy. So no more babies for that family because of Texas's backwards abortion ban.
Well, I'm hoping it is going to be Rovember and we start throwing some of these bums out and maybe cleanse ourselves of the insanity that has propped up in the Republicans. And look, my Republican friends, take your party back. I'm not saying all the way to the sane line, just somewhere near, somewhere in the ballpark of sane. That's all I'm asking for. Is that too much? Yeah, probably. But Laura, I appreciate the time. As always, great stuff.
Thanks.
Our good friend Laura Packard. Make sure you check out the work that she does over at Healthcare Voter, healthcarevoter.org. Make sure you also check out her ACT TV program, Care Talk.